human resources is clearly a necessary partner, but it will not, every major enterprise-wide initiative that resides in a staff function has a very high probability of failing. I saw this with enterprise software, where in the early years, SAP or Oracle implementations ended up being delegated to IT, and they routinely failed. There has to be organization-wide buy-in. And what accountants and financial control people talk about is applicable here. Tone at the top. Tone at the top. So what I want to have Ray and Mark talk about is how do we get away from tone at the top issues? How do we focus, how do we get away from just HR to a tone at the top that can really make a difference here? So either of you guys can talk first.
I'm happy to chime in here first. I don't think it's fair, actually, to delegate this responsibility to human resources alone. But on the flip side, I would say that in research that's been conducted by HealthNEXT over the last decade, benchmark organizations really drive a culture of health, safety, and well-being from the top. And this dedication expresses itself in the corporate mission, vision, and values. So you can identify benchmark culture of health, safety, and well-being companies by looking at their corporate mission statements, their corporate values, their corporate vision. And so often, an organization will talk about the customer and valuing the customer first. I will refer you to another great book, which is called The Customer Comes Second. And in this classic business book, the idea is if you take care of your workforce first, customer service becomes much better. Mark?
Yeah, I think, the leadership from the top is really important, and obviously how this gets cascaded down through the organization, how that sort of the organization lives and breathes their mission and things is really important. So really trying to sort of, to be successful, it sort of has to permeate down through the organization with that strong sort of CEO, C-suite support that's sort of driving it, and rewarding management to the right thing, because often managers are rewarded for basically widgets out of the door and running sort of more of a sweatshop. They get more reward for that than actually having a sort of healthy work environment and driving it through. So there've been there's been a number of ways that this has been done, sort of from obviously educating, training managers, but it's really that walking the talk as you go down through the organization, building it into other parts of the organization as it goes. I mean, often that, HR has its part with its sort of benefits and sort of how people sort of are trained and leadership development. There's the sort of DE&I activities that go on. There's the health and safety activities, and sort of certainly this movement towards sort of total worker health, which is going beyond just the traditional health and safety, to really looking at sort of all those all that aspects of wellness and how that all pulls together. So there's a lot of initiatives out there which organizations can leverage and use to help drive this going forward. But I think often what's really important sometimes is having some expertise to sort of help organizations navigate that route, because from the traditional health and safety and sort of having some sort of occupational medicine experience in terms of hierarchy controls and sort of reducing workplace risk at source, through to sort of navigating all these other aspects of the wellness programs, sort of benefit design and other things. So I think it's really important that organizations also look, not saying they have to have an internal sort of chief medical officer themselves, but how they get that expertise and how they help them navigate along that route. I know, Ray, you're sort of passionate about this sort of guide piece, so maybe you've got some additional things to mention.
Yeah, I like the term physician executive, And physician executives are very well versed in the science of population health and the science of well-being, as well as many of the other components of clinical leadership that Mark has spoken about: occupational health, disability management, case management, complex case management, and topically pandemic preparedness and response. In the research that we did at HealthNEXT, studying benchmark cultures of health, including the one that Mike Critelli built at Pitney Bowes years ago, all of them had access to clinical expertise. And our research suggests that any company that would be of significant size, let's say 20 or 25,000 employees, should have a full-time chief medical officer. Sadly, a corporate chief medical officer is still a relative rarity, even in the Fortune 500.
Yeah, let me just give you a really concrete example of how it becomes active versus, and it even goes beyond mission, values, and vision. Eaton Corporation, on whose board I serve, going way back to Alcoa under Paul O'Neill, Dow Chemical, every single board meeting, the topic of health and safety came up. At the beginning of the meeting, there was a briefing, there were statistical measurements discussed. Every management meeting, every site visit, and the CEO was leading the discussion, not somebody from HR. How CEOs spend their time, what they talk about, whom they meet with. I met regularly with Dr. Jack Mahoney, who would be a physician executive of the type that Ray mentioned. It was really Ray's partner in delivering our health. So it's not just putting words on a sheet of paper one time. It's relentlessly driving home the message in very visible ways, and ultimately tying compensation to some form of a culture of health, which really gets people's attention.